Hi, everybody. I'm Trish Laub, and welcome to A Cup of Comfort with me. This is about you, the care hero. During the first show of A Cup of Comfort, I talked about what a care hero is. I talked about a care hero, the fact that a care hero is someone who is there for another who cannot be there for themselves. I mentioned superheroes like Captain America and Wonder Woman and law enforcement, war heroes, and first responders, all of whom walk into the unknown and do what's needed to be done. And I said that anytime the word hero is used, you know that there's something that somebody did, sometimes extraordinary, sometimes ordinary, that took courage to respond in a time of crisis. I want to remind you that what each of you do is extraordinary, making you a care hero. Today we're going to talk about talk with someone who is one of the types of heroes I just mentioned, a different kind of care hero than those of us who have or are preparing care or providing care. Gosh, I'm tongue-tied today, for a loved one. My introduction to firefighter paramedics was initially uneventful. Dad had slipped and fallen during the night, and being a very large man, my mom and I needed assistance getting him out of the floor. I called the non-emergency number for what I thought was the police department and requested a lift assist. A fire truck carrying several firefighters, including a paramedic, arrived, and after being sure that Dad wasn't injured, got up out of the floor and helped him back into bed. I had no idea why a fire truck and firefighters had arrived, and I actually felt guilty for taking their time. Over time, my family and I needed the non-emergency transport needs several times. Preparing for what I now know was my mom's last ambulance ride, I was already seated in the front of the ambulance by the paramedics, and they were in the back by the person who was driving, and they were in the back and they were getting my mom ready, and they were asking her questions, which she was unable to answer. So, wait for it. I opened my parents' red 3-ring emergency notebook that I had grabbed from my mom's condo, and I was clinging onto it for dear life because it had all the information I needed in it. And I started answering the questions, and from the back I heard, "Ma'am, how long have you been an RN?" To which I responded, "Oh, I'm not. I just have our emergency book with us." My family went a very, very long time without having to call for assistance. But interestingly, once we made that first call, we found that they came much more frequently. We went from no calls to 8 calls for one parent or the other in only 2 months. Our calls for help were relatively benign. In other words, they were not life-threatening. I cannot imagine what a firefighter or paramedic faces when they answer a call for help. They see everything from nosebleeds and lift assists to life-threatening injuries and episodes such as heart attacks. While most care hero journeys are either a sprint to a cure and recovery or a marathon to the ultimate end of life, the firefighter paramedic experiences the short trip that starts with crisis and ends often without knowing the ultimate outcome. And they do it over and over and over. They are literally on the front line, the first responder to crisis that may well later become the beginning of our care hero journey. Now, before I introduce my guest, I want to remind everyone that some of the information from today's show will be available in a downloadable PDF on the CareHero radio page of my website, Trish Laub, that's Trish, L-A-U-B as in boy.com, after the show. AlexdelGaudio served as a paramedic firefighter for 25 years. As a paramedic, she provided care for patients experiencing an acute or worsening health crisis and assisted caregivers in how to best prepare in the event emergency services were necessary in the future. Alex recognized early in her role as an emergency provider that the depth and accuracy of the patient information a caregiver can provide was often key to successful outcomes for patients. Welcome, Alex.
Thank you for having me, Trish.
Oh, it's my pleasure. It's a real honor to have you here to share your experience and your insight with us. So I'm just going to say, let's get going. What the heck happens when I dial 911 and think I'm getting the police department?
That's a really good question. And it's interesting because even, we're in the 2021 and there's still so much confusion about this issue. And depending on where you live, not just in America, but in the world, every system could look a little bit differently. So I'm going to speak kind of in broad terms. So when you call 911 because you're experiencing an emergency, that's going to place you into contact with usually the police department. Well, it'll put you in contact with a dispatcher. Well, then she'll then ask you questions about what is the nature of your emergency, and then she will dispatch the appropriate crews to assist you. So when you're talking to that dispatcher, she's dispatching for the police department and she's dispatching for the fire department, and sometimes she actually may be dispatching for the ambulance service as well. So when you call and make that initial call, you're going to immediately start getting everybody that you need to the scene. So
Okay.
what may be confusing for, like I listened to your intro, and what was confusing for you is that when you call 911 for a medical emergency, you didn't understand why the firefighters showed up.
Right.
Exactly. And that can be really confusing because that's not necessarily something you would expect to see if your person in your care has fallen down and perhaps injured their hip. Why is a fire truck showing up? And here's the reason why. Depending on where you live in the country and also internationally, most 911 is attached to the fire department. And the reason why they send a fire engine or a fire truck is because oftentimes the first responders to any situation are members of the local fire department. And that's because each one of those members is medically trained. So each one of them has either first responder training, EMT training, or at my level of education, I was paramedic. So I was trained to an advanced level. And so when you call 911, the fastest way oftentimes to get a medical crew to your home is by dispatching a fire engine. Now, the reason why additionally you may see an ambulance show up is because obviously we don't transport patients on a fire engine or a fire truck. That's not feasible. So what we need to do is we need to have a transporting agent come to the home with us, and they will be the agency that actually loads the patient into the ambulance and then transfers them to the hospital. Now, in most cases, when the fire engine is there and the ambulance arrives, in most cases, if it's a serious call, as a paramedic, I would also join that patient in the back of the ambulance because I was the one that first initiated care for your loved one. And then I will go in the ambulance with the patient as well. And the reason why you have so many people showing up in your home for what you may consider a non-emergency, because firefighters travel in packs. So, and that's the nature of the work we do. So we always have to travel together, and there's usually anywhere from 2 to 4 of us on a fire engine. Because what happens is, by the very nature of the work that we do, we may leave your home after a medical call, and immediately the tones go off, and now we're being dispatched to a fire. And that requires all hands on deck. So that's why you see so many people arrive at a fire engine, and then you'll see the adjunct ambulance as well.
So you could have one call as a firefighter paramedic. You could have a call that's a lift assist or any number of other things, heart attack, whatever. And your next call could actually be a fire.
Absolutely. In fact, in my personal experience, we've literally been loading the patient, loading the patient into the ambulance for a non-acute emergency, but they still needed to be transported. And while we're doing that, the tones are going off in our radios, and we already know as soon as this patient is on their way, we're off to a fire. So that's why there's so many of us coming to your home in a fire engine, which can oftentimes seem a little overwhelming for both the family and the patient. When you've called because it's maybe even something minor, and all of a sudden you look and you've got 4 burly firefighters standing, in your living room.
In your house in the middle of the night. Yeah.
Exactly. And additionally, 2 other members from the ambulance unit. So there could be 6 people easily standing in your home for a relatively minor emergency. However, if it's something really acute and really critical, again, all hands on deck, and we will utilize all 6 people in that emergency.
So can you help me out here a little bit? I was calling a non-emergency number. It wasn't like a standard number like 911. I had to look it up. Or sometimes I call 911 and say, this is a non-emergency,
right? Because
I couldn't find the non-emergency number. What differentiates? I mean, I know all of this should seem intuitive, but when you're standing there in the middle of the night, looking at your mom, your dad's on the floor, whatever, maybe it's more serious than that. None of this made sense to me. So how would you differentiate those non-emergencies from those emergencies? And when should they call which number?
That's a really good question. And I think, unfortunately, a lot of that comes with experience as a caregiver to understand and differentiate the difference between an emergency and something that is not acute or not critical. I would say, for the most part, I would err on the side of caution and utilize the 911 number if you think, if there's any confusion, I would err on the side of caution and dial 911. Now, that being said, after having to utilize the emergency medical system after a while, you're going to get probably a pretty good understanding of the difference between sick and not sick. That's when I would definitely have and seek out that non-emergency number for your local agencies so that you can use that. Especially, like I think, Trish, we're going to talk about lift assists and whatnot. So if you have a patient under your care that requires assistance once or twice a week, because let's say that they've slipped out of bed, or you're unable to lift them out of the recliner to assist them into a different room, you need help doing that. You know by that time it's not an emergency. Right. That would be the time that you would utilize the non-emergent number. So you can still have people come to your home and assist you. Big thing is you're not going to be coming lights and sirens. And the big difference is we may be a little delayed assisting you if that means on the way to your home, we get a 911 call that it's something acute like a heart attack or stroke or an auto accident or a fire. We would divert to that call and send you somebody else.
Okay.
But I would never want anybody to think that they're putting us out or utilizing a service that isn't necessarily required for fear of thinking that, well, if you come to my home, it means you're not available to come to somebody else's. There's always going to be more service available to the rest of the community, even if we are at your home assisting with somebody who is elderly that isn't having a medical emergency, but still requires assistance.
Okay. I do want to get to like the non-emergency things, but I want to be sure that you have the opportunity to help us understand what kind of information a caregiver can provide to you when you show up that can help you better take care of the person that's having the emergency.
Excellent question. I think the most help is to be very succinct for why we're there. Oftentimes when people get a little stressed or they get nervous, they'll start going into like a story about why we are there. And what I need to know as a paramedic is kind of the who, the what, and the why of why I'm there. And so the most succinct that you can be is to the benefit of the patient, because sometimes time is of the essence. Sometimes we do have time for more of a story, but oftentimes I need to know why I'm here.
Sure, that makes perfect sense. I mentioned this little emergency book that we had, and we actually had a first page on the inside that had it had a list of meds and it had a list of most recent medical history that might be impactful. So we could actually say, okay, here it is.
Yeah.
This is what I know.
Actually, Trish, probably one of the most helpful things from right out of the gate is when you open the door and we're coming in, is you introduce who you are and what your relationship to the patient is.
Wow. Yes.
That's really important, because as a medic, I'm going to be relying on you to give me a bunch of information. And also, I need to know what your relationship to the patient is so that I know I'm talking to the right person.
Sure.
Because there may be somebody else in the home that maybe has a little more authority, more close relationship. So identify yourself, identify your relationship to the patient, and then head us in the right direction. Why are you here?
And it's interesting because I never really thought about that, but that's what we did. But say, hi, I'm Trish. I'm a daughter. My mom's over here. She's in authority. I have all the information you need. Tell me what you want. Tell me what you need.
Because we can't make an assumption that the person that we're speaking to that is a caregiver is even related to the patient.
Sure.
Sometimes I've been 5 or 6 minutes into the call trying to get information before I have to look at them and say, and what is your relationship to the patient? Just to find out that there is no relationship to the patient. They're actually like a neighbor.
Yes. Well, and that's really important because we had overnight caregivers.
Right.
And once or twice, they would call us first and then I'd say, yes, call. And I'm on my way. And when they get there, tell them my phone number if they need approval to do whatever, because I'm a power of attorney if my mom wasn't there. So yeah, it's interesting. Some of that I did. So that's good.
I think a lot of it's really intuitive for a lot of caregivers, but let's be honest, if you don't have experience with activating the 911 system, if it's
Right.
your first time, or if it's a really serious crisis, some of that can all go out the window because it's so much stress on the caregivers and the
Yes.
family that's involved. And that's why you're calling us, because we're the ones that can mitigate that stress for you. And the best way that you can help us help the patient is by giving us as much succinct information as you possibly can. And then to realize that you know the patient way better than I do. I've never met this person before, unless
Sure.
we've been to your house multiple times, which does happen over a series of time with some in-care patients, at-home patients. So the big thing the wisdom that you can gift a 911 responder is, listen, I can't quite put my finger on it, but something's not right with the patient. Like John's just not acting right. And I would ask you a series of questions. Well, tell me more, because you know the patient, you have experience with them, you know their story, and you also have probably a really good instinct. So sometimes utilizing 911 because something just doesn't feel right or something is off with the patient, you share that information with us and you say, I can't put my finger on it. Something's not right. And then we take it from there and ask you a bunch more questions while we're attending the patient to get to the bottom of what's going on. But long-term caregivers, they have so much information to provide 911 responders because of, again, the experience over time, the relationship to the patient, and also that intuition that they have, caring for the patient over that period of time.
There's, in my experience, both in the hospital and in these emergency or non-emergency, in our case, type situations, there was a word that was used, and I've run into situations many times where people don't know what it is, and that word is mentation. They want to know if there's a change in mentation. Can you explain what you're looking for there?
Yeah, so when we refer to mentation, we refer to the cognitive ability of that patient and what is normal, what is a baseline for that patient, so every day, versus you've noticed a change in their mentation, in their cognitive ability to receive information, to communicate, to track a conversation. So when we are referring to somebody's mentation, that's really important. And it's a really big indicator if somebody has had a change in mentation, which really means like a decline. Like they're not tracking in conversations, they're not communicative, they're, when they do communicate, their words are garbled or nonsensical. They seem like they're just checking out and staring off into space. That would be all signs of a change in mentation.
Okay,
and that can be
helpful.
really indicative, especially in elderly patients, because that could actually give us a lot of information.
Okay. I know for both of my parents, as they approached 90, anytime they had a urinary tract infection, their mentation, they like nonsensical things started coming out of their mouths. And I'm like, oh, okay. So we learned that. And I'm not telling any of the CareHeroes out there to assume that, but that was just one case where that was visible.
No, and actually as a paramedic in the field, when we ran on an older person, and we arrived, and it was usually one of those, what the caregiver normally would say is, John's not acting right. And they couldn't say more than that. He's just not acting right.
Yeah.
And sometimes it was really minor, like they were just able to have a normal conversation. They didn't seem to be making much sense. Now, the underlying condition that gives rise to that sort of symptom, that's many, many things. But with an elderly patient, one of the first things as a medic, I would always go down that route of UTI. Not much we can do for that in the field. We can take a temperature, but sometimes it's not even fever related. So that would be a time where they definitely need to go into the hospital and have a workup done to get to the bottom of it, because that's a really actually that could be a benign condition that is easily treatable, but it can look kind of startling in the field. In fact, I had probably the worst or best experience of that was an elderly man, probably in his early 80s, that was really a healthy guy. And one morning, the wife came out to find him sitting nude. This is going to sound like I'm making it up. He was sitting nude on their sofa with a lampshade on his head. And I have to say,
There's something different.
I had to ask, and I'm assuming this is not normal behavior for your husband. And of course it was not. Yeah. And it turned out he had a UTI. So it can literally look that extreme in behavioral changes.
Yes, yes. Well, I want to be sure we get in there. I know that there are some non-emergency things that you can call the non-emergency number, hopefully, for.
Yes.
Can you mention some of those?
So I think you mentioned already lift assists, because there is no reason in the world why, as a caregiver, that you should be jeopardizing your own physicality and well-being, trying to lift and manipulate a patient either off the ground or out of bed. I've seen people fall in showers. I've seen them fall off toilets. You should not be trying to lift them on your own if you know you're physically incapable of doing that. And also you would not want to injure the patient further. So that is a completely legitimate reason to call 911 to get that assistance. The other big one that people don't necessarily think of is nosebleeds. Now, I live in Colorado, where nosebleeds can be relatively common because it's so dry here. But what happens in people who are compromised or elderly is a nosebleed can be an indication of something more significant going on, usually related to like high blood pressure, or it could be a simple nosebleed that is no longer manageable. So if you get a nosebleed and applying pressure and the normal things that you would do isn't working after about probably like 20 minutes or so, that's a legitimate 911 call, because that needs to be addressed, because that can significantly compromise elderly people with the amount of blood loss that they can actually lose. Plus it's going down the back of their throats and irritating their stomachs. And that usually winds up having to get cauterized in the emergency room. Okay. So take nosebleeds very seriously.
Good to know. My dad got them due to blood thinners and they were horrific.
There you go.
So good to know. So let me ask you, as we are getting towards the end here, is there anything else you want the audience to know? You want the care heroes out there to know?
I think I just want to reiterate what you said in your opening about that they truly are heroes. Listen, I responded to medical emergencies for 25 years as a paramedic. And I was with a patient for anywhere between 20 minutes to probably an hour if I went to the hospital with that patient. That was the extent of my contact with patients. I never had the experience of working with a patient and managing and caring for a patient beyond that time frame. And the amount of endurance and perseverance and compassion that takes, doing it so isolated in the home, maybe not always having the resources that you need, that is a remarkable human feat. And they're definitely heroes in my book, because not everybody is cut out for that type of work or caretaking. Yeah. And it takes a tremendous heart to do so.
It does. And I don't mean to rush you, but can you tell people how to reach out to you?
Yes, absolutely. I think it's going to be on the screen somewhere, but if you have any questions, my email is my name. It's alexdelgaudio@comcast.net. And if you have a question or a follow-up question, I'd be more than happy to answer that for you.
Awesome. I could talk to you for another hour about all of this, but I just don't have any more time. I want to thank you so much for sharing what you did. You've clarified so much, and I think it's so important for people to have that clarity, especially when they are in a crisis.
Absolutely.
I thank you so much for coming on. And I want to remind everybody that there's a downloadable PDF on my website, the CareHero radio page, trishlaub.com. Join me every second and fourth Tuesday of the month at 12 Pacific and 3 Eastern. On March 9th, Trish Laub is going to be here to talk about whether that spot on your hip is something you should be worried about. And yes, Trish is a relative and a good friend of mine, and she's helped me personally several times with wound care, and she has valuable information for each and every one of you. We've got some great upcoming shows. We have a CareHero Moment show where a CareHero shared their story. Please go on my website and share your story so I can have you come on and share your story as well. I'm doing a show in April about the power of words, and it probably is my favorite show to do. So until next time, remember that you are a care hero. Thank you for listening to A Cup of Comfort with me, Trish Laub, and for your Care Hero courage. Tune in next time on Transformation Talk Radio as we explore life-changing Care Hero topics to assist you on your journey. In the meantime, I would love to hear any tips or insights that you've taken away with you today. So head on over to trishlaub.com. That's Trish Laub, L-A-U-B as in boy.com, and leave a comment, a question you would like answered, or a topic you'd like to hear about in the future. And while you're there, be sure to subscribe to my newsletter. So raise a cup and let's toast to all the amazing care heroes out there giving it their all. Until next time, remember that you are true heroes.